What's up, guys? It's me, Ken. I am here at the Michael Degroote Pain Clinic in Hamilton, and they have chronic pelvic pain programs. But guess what? I'm not allowed to participate because I'm not a woman. So even though I've been suffering for 2 years with chronic pelvic pain, because I am male, I don't get to participate, which is the biggest load of BS I've ever heard. And I asked them, what's the chances of me getting in as an exception or a male version of the program opening? And they said, maybe in a year. So I should wait another year of horrendous, the worst pain in my life that makes you question whether you want to go on.
Hi guys, it's Ken. I'm just doing a little bit of video about my recent visit to a pain clinic, specifically the Michael Degroote Pain Clinic in Hamilton, Ontario at the McMaster University / hospital area, right? So I was referred there by my family doctor to try to address my long-term running pelvic pain, which hasn't been solved through multiple attempts in the past. So if you've been following in the past, I'll do a quick little update just to catch everyone up. I have chronic rectal pain, and it's so severe that I can't sit down for more than 5 to 10 minutes without being in severe pain. That impacts my ability to work, my ability to drive, my ability to function day to day, to hang out with friends, to go to restaurants, to do anything. If you think about the amount of time you sit day to day, it impacts all that. So there's been multiple attempts to solve this. First they thought it was fissures. They did injections, then they did surgery. They gave me a surgery I didn't need because it turns out I didn't have fissures. Then they've sent me, I've spent probably $2-3 grand on different physiotherapists and osteopaths, etc. And then being slapped with like a million different drugs, which I've got here to show you. So here's Advil. They've got me on Advil, 800 milligrams. This is gabapentin. This is another drug they got me on. This is clonazepam, another drug they got me on to try to address my chronic pelvic pain. More gabapentin, more clonazepam, and this one here is Cymbalta. This is Cymbalta. And the other drug they got, I don't have the thing for it right now, but they had me on Ciprolex as well. So that's a whole whack of drugs to try to treat my chronic pelvic pain, where they actually have no clue what my chronic pelvic pain is. So that brings us up to date, okay? So that brings us up to today. So today I went to the pain clinic at Michael Degroote's, or Michael Degroote in Hamilton, and guess what? I was super lucky because guess what? They have this. Let me get the paper for you here. I don't know if you can read it. Chronic pelvic pain program at the clinic. Guess what? And there's a whole whack of stuff. They do 8-week programs to treat it. There's a whole bunch of, I don't know if you can read that stuff. They do like therapy, look at this, like special anti-inflammatory diets, pacing and self-management, trauma, focus workshops, etc. It's hard for me to read them all. Let me try to read a few more for you. Emotion regulation for pelvic pain, anatomy, working with social psychologists, social workers, occupational therapists, etc. So they offer all of this stuff that would be great for me, a man who's suffering chronic pelvic pain. However, there's a reason it's all crumpled up. And that is, I can't have the treatment. I can't have the treatment because I am a man. Because I have a penis, I am not allowed to be treated in that program. And I asked them, does anyone else do this program in Hamilton, Toronto, Southern Ontario region? They don't know. And then I'm like, can you make an exception to get me into that program? And they would not. They're all just like, no, that's the way the program is. And I was getting really upset at that point. And I'm like, please, I need you to make an exception and get me into this program. Like, I'm dying of chronic pelvic pain, the worst pain of my life. And I'm like, please, you need to get me in. No, because I am a man. And their rationale was, you have a penis. That's basically it. You have a penis, so you can't get treated. That's really it. It really blows my mind. Essentially what they said, okay, so let me give a more elaborate explanation. Essentially what they said was there may be, being the crucial word there, rape victims in these classes for the pelvic floor pain. Therefore, having a man in these classes would be negative for these people. Therefore, I should just suffer forever. My pain doesn't matter because I am a man, right? It doesn't matter because I'm a guy. I should just suck it up, right? So all they gave me, this is all those drugs. All they did was give me more drugs. They're giving me Valium to shove up my butt now, which is another muscle relaxant on top of the other whatever ones I had, and that's it. That was the entire pain clinic that I waited 9+ months, actually a year now, to get into. That was it. They're gonna give me Valium to shove up my butt. That was it. They don't give a flying F about anything that I'm going through, the pain I'm suffering with. When I begged to just be, allowed to be part of this pelvic pain thing, they're just like, you have to understand that other people are in pain too. And I'm like, so what? They're in pain. I get it. I'm not trying to be an asshole. I get it that the women are in pain, but so am I. I've been in pain for 2 years and my pain doesn't matter. I am so sick of being told to get in line, wait longer. When I asked, will there be a male program at some point? They said maybe in a year. And that's a maybe, right? Which probably is a no, right? So it's like bullshit. It's all BS. The entire program is BS. It's women oriented, at least for pelvic issues. You know why? Because women have children, men do not. So there's some kind of bias there because I don't pop out a kid, I'm not important, right? Or there are rape victims. There may be rape victims. Like there are no men who are raped, right? Go look up the studies before you slough me off. Look up the studies. There are men who are raped too. It is not like a only men rape women thing. So look it up. That's complete BS. Anyways, I got upset with the doctor and I said, what study told you that? Oh, and there was one other thing, okay? First of all, I showed up and I had to, of course, the doctor's running late because the doctors are always running late because, God forbid they run on time. Everyone else has to run on time, but not the doctors. So I get there, I have to wait an hour longer. My appointment was for 1, I got seen at 2 o'clock, okay? Then when I finally get into the room, I don't get to see the doctor. I get to see the assistant, and I have to speak to the assistant for 30 minutes about all my symptoms and blah, blah, blah. And before I even start talking to her, I'm like, can I just speak to the doctor directly? I don't want to do this telephone tag stuff. Just give me the doctor and let me just talk to the doctor. And they're like, no, that's not how we work. So the doctor is in the next room over, and I know the doctor's in the next room over, probably doing nothing, right? I don't know what they're doing over there. They're searching on Google or watching YouTube or something, but they're doing nothing, right? Then after dealing with the assistant for 30 minutes, she finally goes and gets the actual doctor. Then the doctor comes in and we have that little confrontation about the pelvic floor program. And then she says she's going to give me Valium, and then she bails. And seeing the actual doctor was maybe 5 to 10 minutes, in that range, probably closer to 5 minutes of seeing the actual pain doctor that I waited almost a year to see. And then she bails, and then the assistant tells me, well, she's leaving for the day, so the prescription that she wants you to do, you're not even gonna get today because she's leaving, so you'll get it tomorrow. You'll get the prescription tomorrow when she gets time to write it. It's just like, are you flipping kidding me? Like, just it's so upsetting. I don't have any more tears to cry. At this point, this is where I would probably break down and cry, but I don't have any tears left to cry. The whole program is just bunk bullshit. Nobody gives a shit about treating you, actually like making you healthy or addressing the issues. Even the whole thing of, here Ken, here is some Valium, shove it up your butt. It's like, guess what? That is not addressing the issues. That is not addressing the issue. That's just another drug. Give me another drug. I don't want any more drugs. I want to fix the issue. You know what would fix the issue? This would fix the issue right here. A pelvic floor program that's specifically tailored to address pelvic floor pain. But because I have a fucking penis, I'm not allowed to be part of it. Fucking sexist shit. I am so tired of this. There was another program like this last year I discovered at a different hospital, and it was the same bullshit. Women only, because women are the only ones with pelvic pain, right? Men never have pelvic pain, apparently. I am the freak occurrence, I guess. I don't know. Do other men have? Actually, I know for a fact that other men have pelvic pain because they inbox me on my fucking YouTube and they find me on Facebook to talk because they watch my video and they're in pain too, and they feel the same fucking way I do right now. They're angry and they're upset, and nobody cares. Nobody cares. The system doesn't care. The Canadian government doesn't care. Nobody cares until you fucking like shame them. Is that what it's gonna come to? Is I have to shame these people publicly in order to get treatment? I think that's what is basically happening, is I have to publicly shame people. Like, I'm not naming names here, but the system is just flipping retarded, and I'm so sick of this stupid system that we have that is just, you know what, Ken? Go wait another year, and maybe in a year there'll be a program for men. Maybe. Oh yeah, and they're like, well, you could go out and find someone to treat you, but I have to pay with my own money. The money that I don't have because I can't go to work because I'm injured, and the government won't give me any subsidies or help me out because they consider me treatable. They said the disability denied me because they said they can give me an injection in a year. It's been a year now, still no injection, and now they're referring me to another place to get a different injection. It's probably going to take another year to get into that clinic and probably be denied there as well. So look at this. Chronic pelvic pain program. This is exactly what I need. Michael whatever Degroote, I can't get it in the camera because there we go. Ridiculous. Sexist. It is 100% sexist. I don't know what else to say. The pain clinic is a joke. I guess I'm supposed to just suffer endlessly. Shove some Valium up your butt and maybe that'll fix the problem. I don't know, guys. I'm sorry to rant like that. But it is very frustrating. Yeah, so, well, if you're suffering like I am, please comment. I have had comments on my other videos, and I appreciate the comments, and I appreciate interacting with you guys, the ones who are also suffering, because we're suffering and it's important to try to support each other. A lot of people, a lot of people don't understand the pain we go through because it's not visible. Because I can't show you like an arm injury or something like that. So they don't understand, but it's important for us, the ones who do suffer, to try to support each other. That's why I filmed these videos. That's why I'm making it public, to try to, it's not just for me, although it does help me. It's to make people aware of the problem, and that and to try to support each other. And everyone who wants to interact in the comments, try to support each other. That's all I could ask. Jeez, get a grip. Oh my goodness. Okay, guys, that's all for now. Thanks for watching. I'm sorry to kind of lose it here. Have a good one.